Hello everyone, this is Eugenia. I'm back with you to do another update from my quarantine. Today is officially day 4. I was notified of my exposure at work on Sunday night, and I'm on lockdown basically in my own home. Right now my kids and my husband stepped out, so I'll be able to record this without the mask. I'll have to clean the whole room afterwards though. Anyway, thank you for joining in. As you can see, I finally received my equipment. I want to make sure to be able to shoot my videos in the best quality possible. This is the first attempt, so I'm sure I'll be able to improve the quality as we go. Anyway, so I'll give a quick update about how I feel, how we're doing, how our state is coping with this pandemic. Also provide some links and numbers for those interested, and also provide some insight from what's going on in the nursing world and how this pandemic affects me and my coworkers basically. Excuse me. So far I feel about the same. I have the cough on and off every once in a while. It's kind of annoying, but I do not have any fevers. I've started checking my fevers 2-3 times a day now, and they all been negative so far, so that's good. My kids are doing okay. Of course, both girls are home with me. I started them on some homework today. They've been doing some math. They've been learning. Obviously, this little one has a little bit of a more easy schedule. The older one is practicing math. She's reading a book. They've been outside in the backyard for a little bit over an hour. We might go walk the dog. Not me, but they might go walk our dog. Chow chow. So far, no changes. My husband's fine. Nobody's showing any symptoms. However, on the news, they showed that 2 more people became positive for COVID-19 in my workplace in the same unit. So, as you know, I'm not sharing any private information here. It's all out in the open public information. It's up on the news. The second article came out that the doctor that was positive exposed about 15 of us, and who are now quarantined in their own homes, and 2 people, so 1 more physician and 1 nurse, tested positive for COVID-19. At work, they basically just send out daily updates. Nobody knows who those people are. On the first day of quarantine, when this information became public that the patient 0 basically in our workplace tested positive, I felt like it was appropriate to share that news article, but my workplace actually called me and asked me nicely for now to take it down. So I don't know why, but tracking my personal Facebook page, and it's public information. Again, I did not disclose anything outside of that news article link, but you know what, it's fine, whatever, for whatever it is. I took that article down. Since then, the new article came out saying that more people tested positive. So, I mean, we know it's coming. It's been coming for months now. It's just kind of surreal that it's finally hits us, and more and more people kind of grow anxious and scared and concerned, especially nurses. So, let's talk about these updates, right? At first, it was jokes, yada yada yada, memes. It's just a flu, it'll be alright. If I get corona, I get corona, who cares? So that was kind of initial first step of adjustment to change like this, right, on this scale. Now that the school's been closed down, the quarantine for kids, the closure of schools was extended till April 6th, I apologize, at least. And after that, they're going to reevaluate and see what all is going to be done. I have been receiving some communication from school. They're preparing a Facebook page where kids will be able to communicate, share ideas about how to spend time, how to learn new things while at home. And also they're preparing a packet with homework so the kids can keep up with their skills and things that they learn, like math and spelling and all of that. So that's good. School's been doing pretty good so far. I understand that it's all new now. All of a sudden they have to do all of this stuff online. So that's quite an adjustment. There are a couple charter schools in my area. They do not use computers or anything at all. They use classic method of education. So unfortunately for those kids, parents will have to either drive up or I'm not sure which way the educational packets will be delivered, but it will be on paper form, the assignments that they will have to do. But that's fine. At least that's going to be done as well. I think they've been a little bit more proactive about that than the average general schools, public schools. So that's as far as schools go. With my little one, I had to pull her out of the pre-kindergarten basically. Once I was told that I have to self-quarantine, I was exposed one-to-one with a coronavirus person. I called the school immediately, notified the school director. Obviously my daughter's not going there anymore. I just decided to pull her out because that school is very expensive. The director was kind of meeting us halfway. It's usually a 2-week notification before you can pull the child out and stop payments. They charge us for 1 week, but they told us we won't be charged for the second week. And obviously my child's not going there anyway. So we lost some money, but not as much as we could have lost. But childcare, that particular one, still stays open. They did do some changes. They update parents daily, from what I understand. Instead of walking kids in the school, they now allow only one time to drop off your kids outside, where teacher goes outside, takes the kids, goes in, and one time to pick them up. So that's a change, and most of other childcare places and facilities have been closed. My workplace did announce that they will be making some sort of arrangement for healthcare workers' kids to gather together. Hopefully they comply with CDC requirements of more than 10 people in the same room. But that's nice, at least, excuse me, at least those people that have to work will be able to do so without leaving their child unattended or have to stay at home. As far as updates go, I wanted to let you know, I have my laptop in front of me, that's why I look down. The very good website to check how many coronavirus people are currently in each country is a website called worldometers.info//coronavirus. And then there you can click on the word countries, and that will show you current updated information about just the worldwide general total COVID-19 number of cases, and then you can click on each country. This morning when I checked this information, and it updates at least once daily, I think it actually more live now, where it gets updated to the current numbers more frequently. So this morning when I checked the website, it was about over 10,000 cases. Yesterday was 9 and change. So right now, let me renew it just to make sure I give you guys the newest information. So currently USA, total cases 13,622. Oh my God. So I'm sorry, it's just so scary, and I feel so sad for all the people that have to go through this. I read one article today about a mother of 6 that survived breast cancer passing away in Texas because of coronavirus, and she was a single mom, so all 6 kids now without parents. So it's been very close, hitting close home to me, as I work with the sickest people with the most vulnerable, the immunodeficient, the immunosuppressed, people that fight all kinds of diseases, and now this. It's just, and that's with the fact that testing is so low, like 13,000 people. That's just insane. So new cases in the last 24 hours, 4,363. Total deaths, 189. It seems just like it was just a couple of days ago when we saw first deaths in Washington state. And now somehow it's 189. So close to 200 people now dead. So that's 39 new deaths in the last 24 hours. Recovered 108. I wonder how they trace that if we can't even get tested to verify if we have carriers, if we have coronavirus or not. Who would follow up to test those that are actually already sick? If tests are so sparse, and I don't even know. Okay, but it's still very low. Out of 13,622 people, 108 recovered. That's a low number. Active cases, 13,325. Critical, 64. Total cases per 1 million of population is 41. Still low, but again, sorry, let me silence that. Just very low number, you know. So right now, USA 1, 2, 3, 4, 5, the 6th spot in the world. China on the 1st, Italy 2nd, Iran 3rd, Spain 4th, Germany 5th, and USA 6th. So we had now over the France and South Korea, Switzerland, UK. Switzerland is growing too, 4,200 cases and some. So that's a good resource if you want to follow up with that and see daily updates. That I feel like that's a really good resource to check. Also, I wanted to talk to you about the newest CDC updates for nurses. That was one of my concerns too, from things I've witnessed, and you can see that interview that I had with Alexander Hvastovich about what was the current state in the ICUs as far as masks go and stuff like that, like PPEs, personal protective equipment. But that was before we faced this, really. Now that I'm at home, I can only imagine that how daily it's just getting more and more frustrating for nurses not to have masks, not to have a way to protect themselves. So, excuse me, from the newest information on the unit that I do work still, they make people now wear one mask a day. So just one paper mask, not N95 or anything like that, just one mask per person per day. They're now not letting visitors to come in freely. They're checking the temperatures, which is wise. I feel like we shouldn't have any visitors right now. There are things and ways to have visitors, via Skype, any kind of video conferencing devices, phones, Facebook Lives and all of that. I don't think that they have to be there in person. But again, we can't deny patients those rights. Yeah, that's not enough, you guys. That's not enough. I mean, we have so many unconfirmed cases now around us that paper mask is just not going to do it. And so far I haven't seen any kind of PPE but beyond the paper mask. I was told by my coworker from another place that they did create a separate unit for COVID-19 patients, and those people that take direct care of the confirmed cases have plastic gowns, face shield, mask. I'm not sure which mask, unfortunately they didn't clarify that. But again, I mean, that's at that time it was 2 or 3 cases, and we know there are more than that. In my county, there were 135 tests completed, and 29 came back positive, and 11 were looking like positives but have not been confirmed. So it's a pretty big amount if you think of it. In the whole county, only a little bit over 100 people were tested. That's just insane. The requirement to be tested has been a lot harder now, more complicated approach. So you have to be either exposed directly to the person that's confirmed to have COVID-19, or you have to have a travel history to one of those hotspots. Plus, you have to have a recommendation by your primary care provider that you should be tested, meaning that you want to have an appointment with symptoms, you have been ruled out for flu, strep throat, all of that stuff, and then they give you a paper that says that they recommend you being tested, which basically puts you in line, but it's not even warranted that you'll get tested. From people around me, thank God my family is doing okay. My neighbor just texted me. She said her husband has some respiratory issues, cough, symptoms that look like bronchitis, which is very unfortunate, and they have a child with heart defect that she was born with, so she's a high-risk child, so they're really afraid that if he is positive, she might get very, very sick. And he went, so currently he's a primary care location being tested for flu. Flu came back negative. They check in for other things. So, and just a couple of minutes ago, she texted me that they put him on a call list. And I was like, what kind of call list? She said, probably to be tested. She's like, we don't even know yet. So there's that. Very upsetting. So in just a matter of days since you guys saw my interview, so many things are changing. Things that I witnessed and noticed and verbalized, that if you compare the way healthcare providers are protected in China and Italy, where it's full hazmat suit, they're fully covered, in how US nurses just have a mask, or if anything, just like plastic covering that leaves the neck exposed, the back exposed, the sleeves end right here and just below the knee. That's just insane. More and more nurses step forward and share the information that we need to demand PPEs, that we should not put ourselves at risk, that the government and the hospitals knew about this common pandemic. And it's not our fault that they're not prepared, and it's not appropriate to expect people to just risk their lives and carry it back home to their loved ones, to the elderly ones. And it's just a growing anxiety, and I think it has to be dealt with. Some people demand hazard pay, some people ask for healthcare, education, loan forgiveness. Some states offer higher salary for nurses that are traveling or willing to travel to these hotspots, like New York City, Washington, California, to work with COVID-19 patients. Those offers offer about $4,000 per week, which if you work 3 shifts for $4,000, it's a little over $1,000 per shift. That's, pretty great pay for nurses. But those that are currently employed at those places are paid at the same rate that they were paid. The workplaces take volunteers to go work on those COVID-19 units. They're preparing the list. Of course, not of course, but most people do not want to volunteer if it's the same pay, if there's no confirmation that if they quarantine, they will be paid. Most of the places are saying that nurses will be paid out of PTO if they have to quarantine themselves or if they get sick. But again, there's nothing in writing, nothing official that says that. We know that President Trump had a speech about paid sick leave, but for now it hasn't been implemented. I was actually in contact with my workplace today with HR, Human Resources, and I spoke with their executive director. She unfortunately did not know anything yet. She did confirm that it is considered exposure at workplace. Okay, I apologize. I'm so sorry. And sorry about that. So the executive director did confirm that it is exposure and it's considered kind of like an injury at workplace that has to be reported. So she suggested I call employee compensation and start an application with them about my quarantine, which I did call them, and they told me that I am on the list that tracks the infection control, has been notified. They have my information. They know that I'm being quarantined officially on the local level. Sorry about short break. So basically no one told me anything. I still don't know if I'm going to be paid or not. They have my information down. They said that I'm on the list, that I've been quarantined, so they're aware. They'll have to let me know later when they find out what's going to happen. And that before I return to work, I have to be basically not tested, but they said I have to have a follow-up appointment 2 days prior to returning to work. My next scheduled shift is April 2nd, so they suggested on the 30th or 31st I have to basically show up and be examined, I guess, in some sort of way. CDC, however, today put out 2 sets of information. One is that they're considering canceling quarantine for those that are exposed to confirmed COVID-19 cases. So basically, like people like me, they're not going to quarantine people anymore. So they suggest that those exposed continue to work, just they will have to wear a paper mask during their shift. And that's with people that are possibly asymptomatic and shedding the virus and exposing patients to that and their coworkers, and that's just, I can't fit it in my brain. I'm sorry. I think that is just a ridiculous idea, especially coming from CDC. And then the second set of information is that they recommend nurses to use scarves and bandanas as official method of protection against COVID-19, in the view that there's a lack of PPE, is basically masks, and that is just unacceptable. A lot of nurses are expressing the concerns that they're not going to be in the front line for much longer. Many have kids, many have newborns, many are pregnant. It's a majority of the nurses are females, and life's been going on. Like, it's not like we've all been preparing for it for years. No, like, it caught us off guard, it caught us where we're at, and everyone's trying to adjust to it. So I say use bandanas and scarves. That is not an approved way to be protected. If it's airborne, we're pretty much doomed. So I'm really not sure as to what's going to happen. So those that won't quit, they will go to work and they will get sick. And they will spread it to patients that are already sick, and that maybe don't have COVID or there for other reasons, and they're going to spread it to other coworkers. And just FYI, it's not just doctors and nurses in the hospital, it's a lot of staff. It's cleaning crews, it's dietary, it's physical therapy, respiratory therapists, physicians, managers, unit directors, lots of staff. That's a lot of people running those things. So not to mention that we basically will be breeding the virus in our own walls, in the place that's supposed to protect and heal and be safe. I'm just speechless, Looking at our country, that's a world leader, at least was till now. I'm very disappointed to see such a treatment, such a just downplaying of the risk, underappreciation of nurses, everything's under, subpar to how it's supposed to be for a country this size. That's totally unprepared. And I'm afraid to think what's going to happen if there's nobody at the bedside to treat the patients. Will our patients? We always jump in, to save the day. I've seen nurses share the information that there is no emergency in the pandemic. That when things are this bad, don't jump in. If the alarm or pump is beeping, if someone's coding, make sure you put your PPEs on. Because if you're out of the game, someone else not going to be saved. Someone else going to get sick. You know, we have to put our PPEs on first before we enter the room. And that's already scary. We'll be losing some just because of that. So this is the update. I hope that, you know, with China's quarantine being somewhat lifted, maybe some of them will come back to work and be able to get back to the production of masks and PPEs. Maybe release of governmental funds will provide some sort of cushion to get more PPEs in and running and made. But let's hope that there will be some sort of solution and coming soon, because otherwise we're in big trouble. Thank you for being with me today for this update. I hope that this quality is a little better for you all. I hope the sound's okay. I'll double check and improve it as we go. And I hope to hear from you guys tomorrow. Again, I'll list all those links below if you're wanting to see for yourself all the information. Stay safe, be safe, make sure you put your family first, and yeah, I just stay strong. I know we'll see the end of this. It's just what we do while we're in it. You know, we have to unite and be strong together and be strong for each other. Thank you. Have a good day. Bye-bye.